Hi everyone, and welcome to week 6. This week we'll be covering chapters 11 and 12. The objectives for this week are as follows. You will be defining mental health, mental disorders, and explain the prevalence of mental disorders in the United States. You will be able to provide some of the causes of mental disorders. Additionally, you'll be able to define stress and how it impacts our physical and mental health, as well as talk about some of the prevention methods in terms of primary, secondary, and tertiary for mental disorders. You'll be able to also list and describe the approaches to treating mental health disorders. For Chapter 12, you'll be able to identify personal and community consequences of alcohol and other drug use. You will be able to find drug use, misuse, abuse, drug dependence. Discuss some of the risk factors and protective factors for the abuse of drugs and alcohol. Define the terms controlled substances and illicit drugs and give examples of each. And then finally, talk about primary, secondary, and tertiary prevention as it relates to drug abuse and drug prevention. The assignments that will be due this week, you will have a stressed out blog. You will create a graphic organizer on governmental agencies. You will have a quiz on chapters 11 and 12, and of course your discussion board posts. For the stressed out blog, the purpose of the assignment is to consider how stress impacts your life as a college student. So to complete it, I want you to think about your own experiences as a college student and identify some of the factors that cause stress in your life. So for this blog, I'd like you to share how you handle stress and cite some specific examples of stress you are experiencing right now as a college student. For the graphic organizer on governmental agencies, again, you will use chapters 11 and 12 in your book. You may also use internet resources to help you complete this assignment. But ultimately, what you will do is create a graphic organizer on different governmental drug prevention agencies. And here are some of the items I'd like you to include in your graphic organizer. So the Department of Health and Human Services, Substance Abuse and Mental Health Services, also known as SAMHSA, the National Institute on Drug Abuse, Department of Homeland Security, Department of Justice, Bureau of Alcohol, Tobacco, Firearms, and Explosives. You can also include other federal agencies, state agencies, and local agencies. On this slide, I just provided one example of a way that you can complete this assignment. So on your top level for the graphic organizer, you would have government agencies, and you can split them up into 3 ways: federal agencies, state agencies, and local agencies. And so coming off of the federal agencies, I just placed the Department of Health and Human Services, as well as the Substance Abuse and Mental Health Services. The next step, I just did one over here, was tell me, what does this agency do and what services do they offer? And so you would do the same box for each of these over here. Obviously, for the state agencies, you would try to come up with a couple more that would belong over here, as well as local agencies. As you're completing this assignment, if you need help creating a graphic organizer, just send me an email and I can provide you with several free websites and tools on creating graphic organizers. So that brings us here to chapter 11, which is on mental health. Mental health, mental illness is the current leading cause of disability in North America and Europe. And it is estimated that 1/4 of all Americans have a diagnosable mental health disorder. Of those, only 38% receive treatment. And you have to think about why only less than 1/2 of people with a mental health disorder receive treatment. Is it because they don't have access to mental health resources? They don't have the funds or insurance to go seek out treatment for their mental health disorder? Do they not realize that they have a diagnosable mental health disorder? Is there stigma attached to mental health disorder? So there are many reasons that lead people not to seek out treatment for their mental health disorder. And as you can imagine, the needs of people with mental illnesses are very diverse. And so the services that are offered need to also match that diverseness amongst the people. Just some quick definitions. So mental health is your emotional and social well-being. A mental illness are all diagnosable mental disorders. And mental disorders are health conditions characterized by alterations in thinking, mood, or behavior associated with distress and or impaired functioning. When we think about good mental health, it's a hard term to describe, but generally adults with good mental health are able to function under adversity. They're able to adapt to changes around them, which is often very difficult for people to adapt to changes and can cause stress, but ultimately being able to work through it would be considered good mental health. To maintain control over tension and anxiety, to find more satisfaction in giving than receiving, to show consideration for others or empathy, to curb your hate and guilt, and to be able to love others and yourself. So there are many different causes of mental health disorders. Some of it can arise from poor prenatal care, postnatal environment. It's heritable, meaning that there are some genetic markers that makes one more susceptible to mental disorders. Brain function impairment, substance abuse, having a maladaptive family functioning or a negative family environment, and stress. In addition, PTSD can also cause mental health disorders, as well as also being a mental health disorder. When we think about stress, we tend to think about stress as a negative thing, but truly, humans could not live without stress. And we have a normal range of stress that we need on a daily basis, our optimal levels of stress. Where it becomes maladaptive, where it becomes dangerous, is when we encounter large amounts of stress and don't have any mechanism to deal with it or handle it or reduce our stress. So the definition of stress is really your psychological and physical response to a stressor. A stressor is anything that causes stress. It could be your job. It could be being a student. It could be picking out your outfit for the weekend or getting ready for an exam or getting ready for your first job interview. So as you can see from the examples I provided, it's not all negative. Oftentimes stress helps us get motivated to complete an action. For an example, if you have a test coming up and that's giving you some stress, then perhaps studying for it and starting to prepare for that test will alleviate the stress. And on the other side, it helps you be more successful in life by preparing for it. Our body has adapted to handle stress back in caveman days. And we have this reaction called a fight or flight reaction. And basically, think of our ancestors, when they encountered stress, it was generally one of two things. One, they were looking to hunt food, and so they had to adapt to be able to have a lot of energy to go hunt the woolly mammoth, or they were being hunted by something bigger and again would have to adapt to be able to get away from that predator. And so as a result, our body has adapted several conditions to help in those stressful situations. And some of the adaptations our body goes through is our heart rate quickens, our respiration increases, or our breathing increases, our digestion slows down. Our senses sharpen. So actually, when you're in a stressful situation, you can see better, you can hear better. And one of the examples I always provide about that is, imagine being home alone and it's nighttime and it's dark and it's a little scary, and you start to hear maybe the leaves or the branches outside, and it causes a stress reaction. And then all of a sudden, it just seems like you can hear everything that's going on, the clock ticking, the noises the house makes when it creaks. What's happening is you're actually hearing better under that stress condition. Now, the problem with this adaptation that our body came up with is that the stress we encounter today is very different from the stress we encountered during our caveman days, right? When we encounter stress now, it's more likely, more often than not, we're not trying to hunt something or we're not being hunted. Our stress is more mental and emotional. And so therefore our physical reactions, the heart rate quickening, our senses sharpening, really don't help us. They don't serve our stressful situations. And so as a result, we need to learn some other stress management techniques to be able to handle the stressors that we encounter today. People with serious mental illnesses have really improved significantly in the past 50 years. And a lot of it can be attributed to having more services available for mental health disorders, an improvement in education about mental health disorders, and again, more treatment options. However, some challenges still remain in the US. How do we provide services to the homeless, where obviously it's an underserved population? They're harder to reach, right? They don't have a permanent address. How do we find out where they are? There's also this perception that mental illness is linked to extreme violence, and that is certainly not the case. And then how do we handle people with mental illnesses who are incarcerated or who are in jail? When we look at homelessness in the US, we have about 2.1 million adults who experience homelessness over the course of a year. Of those, 80% are temporarily homeless. So perhaps they were evicted or they lost their home, but it's a temporary situation. 10% experience episodically homelessness. So what that means is that they're homeless sometimes, other times they're not. So it just keeps going back and forth between having a home and not having a home. And then 10% are chronically homeless. So they are chronically do not have a home or do not have a home. What they found is that half of all homeless adults have some sort of substance use disorder, major depression, or other co-occurring mental illness. And so we have to identify and think about how do we provide interventions and treatments to people who are homeless, and think about their needs are very different from someone who has a home, right? So if you think about Maslow's hierarchy of needs, you know, the first ones are your basic needs, and basic need is housing. So before you can even address the mental disorder, you first need to make sure that there is stable housing for that person so that they can feel home and safe before they can even address the mental illness. When we look at mental illness and violence, there tends to be this perception that people who are mentally ill are violent, and it's really just not true. In fact, if you can see the statistic here, only 7.5% of crimes committed by people with serious mental disorders were directly related to those symptoms of mental illnesses. We look at mental health care in jails and prisons. So there are a lot of prisoners who are experiencing seriously mental illnesses, and they also experience them at much higher rates than the general population. And the truth is, when we look at the purpose of correctional facilities, prisons, and jails, it's really to confine and punish, not so much to provide treatment. So there's lack of space, there's lack of treatment personnel, and access to services in jails and prison. The problem with that is that once these people are released, they are no better when they came into jail and are more likely to recommit crimes. And so it'd be very advantageous for our prison systems and jail systems to provide services for mental health disorders to their prisoners so that when they come out of jail, they don't recommit crimes, that they're able to re-enter society and be a functioning and contributing member of society. So the 3 levels of prevention for mental health disorders, you have primary, and the goal is to reduce the incidence of mental illness and related problems. You have your secondary prevention, which reduces prevalence by shortening the duration of episodes, so shortening the duration of depression or manic. And then finally is tertiary, where really the goal is treatment and rehabilitation. So the goals of treatment of mental disorders are varied. So it could be to reduce the symptoms, to help improve personal and social functioning in society, to help people develop and strengthen their coping skills to better manage mental disorders, and just generally to promote behaviors that will make a person's life better. Mental health disorders can also be treated through pharmacology, and so this is through prescription medications. there are many conditions for which medications can improve all of the above, right? The symptoms, the duration of the symptoms, the intensity of the symptoms, and oftentimes these medications are very effective. It's even more effective when it's combined with psychotherapy, which we'll talk about in the next slide. The last category here, other biomedical therapy, ET is electroconvulsive therapy, which used to be known as the electric shock therapy. It sounds barbaric, but there has been a lot of research to show that it's really beneficial in treating severe depression. And what happens is the person is given a depressant or relaxation pill to help their muscles relax. So they oftentimes don't even remember undergoing the treatment. And then some low wave energy is pulsed through their body. And what this does, it seems to reset the brain in a way that it allows the brain to bypass its depression. And as I said, it's been pretty effective. Psychotherapy is treatment through verbal communication. So it's working with a therapist, a counselor, a psychologist, a psychiatrist. There are numerous approaches, including cognitive behavioral therapy. It's more likely to be successful as a treatment on its own, so not using other drugs as well, for less severe cases. Some of the current challenges regarding mental health disorders in the U.S. today, as you can see, that first one is oftentimes there are multiple services needed, multiple treatments needed. It's not just prescribing a pill and calling it a day, or it's not just attending treatment and calling it a day. It really involves wraparound services. So if you think about the homeless population, right, so it's finding housing and support for housing, then maybe mental health treatment disorders and how to get a job and how to maintain a job. So it has to be this wraparound service that supports other areas in their life, not just mental health disorders. In addition, staff turnover is relatively high in mental health treatment facilities. Oftentimes they're lower paid, and it's difficult to keep staff in those positions. The system is decentralized and fragmented. So think about what I just said when we talk about wraparound services. So you need to make sure the person who is helping the patient with housing is communicating with their counselor and the other social service agencies so that there is this comprehensive approach to the patient. Lack of licensed providers in rural and low-income counties, and just lack of competence among providers. As such a diverse country, we really need to make sure that our providers have the cultural competence to be able to handle a caseload of diverse patients. Now we're moving on to Chapter 12, which is really talking about substance abuse. So the use, misuse, and abuse of mind-altering substances predates recorded history. In other words, humans have been using drugs as long as humans have been around. Chronic alcohol and other drug abuse or dependence is regarded as destructive behavior in most cultures. It is not only the person themselves, but the people around the person, relatives, spouses, children, as well as the community and society. So the scope of the current drug problem is that more deaths, illnesses, and disabilities can be attributed to substance abuse than any other preventable health condition. The economic costs are quite high for substance abuse in our country, and they include direct costs and indirect costs. Direct costs would be things like healthcare, premature death, impaired productivity, not being able to work, whereas indirect costs are crime and law enforcement, the court system, jails, and social work. And those that abuse drugs and alcohol are a threat to themselves, their families, and the communities. So you can hear the most common types of drugs and the deaths from those drugs. And on the right column is what the cost is to society in billions. So as you can see here, the drug with the highest death rate is tobacco, followed by alcohol, and illicit drugs are illegal drugs. And then again, on the right column, you can see that tobacco costs society the most economic costs, followed by alcohol and then illicit drugs. So some definitions definitions for this chapter, drugs is a substance other than food that when taken in small quantities, alters one's physical, mental, emotional state. A psychoactive drug are drugs that alter your sensory perceptions, mood, thought processes, or behavior. Drug use is a non-evaluative term. It just refers to drug-taking behavior in general. Any drug-taking behavior. It's not specific at all. We look at drug misuse. It's the inappropriate use of prescription or non-prescription drugs. This could be not taking all of your antibiotics because you're saving some for the next time you get sick. It could be taking cough medicine at intervals that are too soon. So usually, depending on which cough medicine you have, if it says take every 4 hours and you take it every 2 hours, that would be considered drug misuse. Drug abuse, therefore, is the use of a drug even when it hurts your own health or well-being. Drug dependence or chemical dependence is a psychological and physical state that is characterized by a craving for a drug. This could be shown by having withdrawal symptoms when you stop taking the drug. And then last, psychological dependence is a psychological or just mind craving for the drug. So there are many factors that contribute to drug and alcohol use, but they can be categorized too. You have risk factors, and these are factors that increase the probability of drug use. It could be that you grew up in a bad family environment, you grew up in a community that drug use was really high, failing at school, having friends that do drugs, all of those would be considered risk factors. On the other hand, there are protective factors, and these are factors that lower the probability of drug use. This would be growing up in a stable family environment, having friends that don't do drugs, having a social support system, doing well in school. All of those factors reduce the probability that a person will have a drug problem. So as I said, drug use is heritable, meaning that if a person's parents, biological parents, have a drug abuse problem, that there have been studies to show that you can inherit those drug problems. There are some genetic markers that make one more susceptible to having a problem with drugs. It doesn't necessarily mean that you're going to have a drug problem for sure. It just means you have an increased probability. There are also environmental risk factors. So as I mentioned, home and family life. Do you have a stable home and family life versus an unstable home and family life? Personal factors. Are you a social person? Do you have some friends and close friends that you can turn to? Or do you feel isolated and don't have a lot of people that you can turn to? The school and peer groups that you're involved with. Are they ones that do drugs, ones that do not do drugs? And then the socio-cultural environment that you live in. And so if you live in a community where drug use is high, it increases your risk of drug use. If you live in a community that drug use is low and there's not a lot of availability of drugs, then your risks for drug use and abuse are lower. So there are two types of drugs basically out there. You have legal drugs and controlled substances and illegal drugs. So legal drugs are, alcohol, nicotine. It could be over-the-counter drugs and prescription drugs, whereas illegal drugs are, so you see I have marijuana here in italics, and it's because, as I know, it is legal now in Illinois. However, federally, marijuana is still an illegal substance. Other illegal drugs are narcotics, cocaine, crack, hallucinogens, stimulants, depressants, blood drugs, designer drugs. Anabolic drugs would be things like steroids and inhalants. So what the government has done is they place drugs on a schedule based on how addictive they feel they are, how dangerous they feel they are, and what are the medical qualities. So the Schedule 1 would be like the most dangerous drugs, and they have no medical qualities. And then all the way up to Schedule 5, which has like the lowest rate of abuse. There's accepted medical qualities. A prescription is required. So it's interesting that according to the federal government, marijuana is a Schedule 1 substance, meaning there is no medicinal value. It has the most potential for abuse and dependence and is the most dangerous. And as you can see, it Heroin is also a Schedule I drug. So it makes you wonder, why has the government placed marijuana and heroin on the same schedule? When we look at drug prevention and the control of drug abuse, you have to think about several items. So first, what caused the person to start the drug-taking behavior? What were the risk factors that caused the person to want to take it? Because you have to look at the underlying reasons for drug-taking behavior when considering a treatment plan. You have to look at the sources of illicit drugs. Where are they getting their drug source? You also have to look at the drug laws, treatment programs available, and community organizing skills and community resources. The 3 levels of prevention for drugs are your primary prevention, which is really aimed at those who have never used drugs, and the goal of it is to make sure they don't use drugs. Secondary prevention is aimed at those who have used drugs but are not addicted, they are not chronic users, maybe they just use drugs in social situations or just tried it once or twice. And finally, you have your tertiary prevention, which is really aimed at drug abuse treatment and aftercare. So for those who already have a major problem with drugs in their life. The several elements of prevention, you can do an educational campaign, whether in the schools or community-wide. Obviously, you need treatment programs. You need to look at the public policy for drugs in the community. Law enforcement, educational, and treatment goals are essentially the same, and that is to reduce the demand for drugs, right? If you reduce the demand for drugs, then drug abuse becomes a less problem. And public policy and law enforcement goals are the same, and their goals are to reduce the supply and availability of drugs. And the belief is that if the supply and if drugs are not available, then people won't be able to do them. That concludes the PowerPoint for week 6. Have a wonderful week, and as always, email me if you have any questions.